Possible to be allergic to an antibiotic? That's one. And then what are the side effects that could come from taking antibiotics? Are there no side effects? Because almost every drug seems to have a side effect.
Of course, antibiotics has their own side effects.
Okay, please enlighten
There are
us.
some mild side effects like nausea, vomiting, even diarrhea, even at times some rashes. Why there are some antibiotics that have peculiar side effects. There is this particular one that that is even written you shouldn't give it to anybody, give it to children, anyone less than 14 years, because it has a bone marrow side effect. So it shouldn't be given to children less than 14 years old. Not necessarily bone marrow. It locks this bone that you use to grow. So, and you don't give it to children because it could lock the bone and they will stop growing. I'm just using, these are the terms I can use, layman terms, exactly. If I were talking to medical personnel, I will use the real terms for it. So it could lock it up and they will not grow again. So you give it to people that have already finished growing, so to speak. That one is one of the side effects. Tetracycline, that we see people even take it as a OTC drug. When taken with milk, it could cause discoloration of the teeth. Yeah. There are some other ones too, rashes on the skin, even different from this one is just normal side effect. There are some anaphylactic shock. You just give the antibiotics and the person will just kind of collapse. Yes, you will have to start reviving him. Even there are some you see, we call it idiosyncratic reaction, like the one you said your friend has allergic reaction to it. You may not really know you have it until you've experienced it. So when you've experienced it before, the doctor will now tell you, or the pharmacist will now tell you, you should be wary of anything, especially the sulfonamides, anything that has sulfur. And people are really, we have majority of people that are allergic to that sulfur. So at times it could come out as swollen lips, swollen tongue, even just different reactions. And you start battling with the recovery of such a reaction. So whatever it is your own, we call it idiosyncratic reaction, your own. Somebody may not, even your twin sister may not even react that way, just your own personal, maybe because of your kind of blood group or whatever, that makes you react to that chemical. And it's not binding on everybody, just you, idiosyncratic reaction. While there are other ones like the cephalosporins, I'm calling the general names. It is so effective in killing microorganisms such that we have some good microorganisms in the gut, in the body. They are commensals in the GIT tract. And one of them stays in the gut. It produces vitamin K. It's a microorganism, but we call it good microorganism because they produce vitamin K for the body. And we need vitamin K to cause clotting. When you have injury, bleeding, to cause clotting. That's prevent bleeding. So now this antibiotic is so broad spectrum. It's so effective. Let me use that word. It's so effective that it even kills that one. And now, yes, because you understand, it kills it and prevents the person from having vitamin K, such that when the person has injury, he will now be bleeding. Yes, we call it a prolonged bleeding time, because you're not supposed to have it. You're not supposed to have prolonged bleeding time. After bleeding, it's supposed to stop. But now it will not have prolonged. It may even bleed till, God forbid, till death, or as the case may be. So antibiotics can also cause that one, prolonged bleeding time. Just like that. So for a pharmacist, if he knows that you are on this drug, he will probably tell you, don't involve in anything that may lead to injury because of this. But for those that do not really know these things, they just give you antibiotics like that and go, not knowing these are the implications that could come from it. So just like that, they all have
their own side effects.
Yes, unique side effects. Other than the normal, some could also give you GIT upsets. When you start having some stomach upsets, stomach disturbance, maybe indigestion or things like that. But the normal general one is just nausea, vomiting, and maybe headache or so. Just mild ones.